Good morning, everyone. Myself, Dr. Kirti, Assistant Professor, Physiotherapy Department. Today, we'll discuss about ankle joint. So, ankle joint is a synovial hinge joint. The lateral malleoli of fibula and medial malleoli of tibia, along with inferior surface of distal tibia, articulate with three facets of talus, which are covered by the cartilage. So, we are having the proximal tibiofibular joint, which is a plain synovial joint formed by articulation of head of fibula with posterolateral aspect of tibia, and each joint is surrounded by capsule and reinforced by the anterior posterior tibiofibular ligaments. They are anatomically separate from knee joint, and the motion available is variable. And in this figure we can see the proximal and distal tibiofibular joint. Distal tibiofibular joint, which is a syndesmosis or a fibrous union between concave facet of tibia and convex facet of fibula. They don't actually come in contact but separated by the fibroadipose tissue. There is no joint capsule, but there are several associated ligaments. The ligaments are primarily responsible for maintaining the stable motility, and interosseous membrane directly support both joint. And distal tibiofibular is extremely strong articulation. The fibula, in fact, light weight bearing function, no more than 10% of weight comes through femoris, transmitted through fibula. So distal articular surface, the body of talus form distal articulation of angle. The body has three articular surface: fibular facet or medial facet and superior facet. Large convex trochlear surface has a central groove that runs at a slight angle to head neck of the talus, and articular cartilage covering the trochlea is continuous with cartilage covering more extensive lateral facet. So in this we can see the body of talus with its trochlear surface. Medial facet, lateral facet form the distal aspect of the ankle joint. So we can see this is the body of the talus. Here we are having the medial facet, here is the lateral facet, head of calcaneum, head of navicular and scuboid. So there are some definitions of motion. So three motions are available, like dorsiflexion, plantarflexion in sagittal plane, inversion, eversion in frontal plane, abduction, adduction in the transverse plane. So these are the cardinal axes for motions of ankle foot complex. So we can see the vertical axis for abduction, adduction. So we can see this is the vertical axis. So this is the longitudinal axis for inversion, eversion. This is the coronal axis for dorsiflexion and plantarflexion. So valgus and varus are sometimes used to refer the fixed deformities in ankle foot complex, whereas at other times the terms are used to describe as synonym for normal motion. So in this we can see valgus is calcaneovalgus or calcaneovarus, or calcaneovalgus means there is increase in median angle between calcaneus and posterior leg, and varus refers to decrease in the medial angle between calcaneus and posterior leg. Capsule is thin and weak anteriorly posteriorly. So stability depends on the ligamental structure, and which support our proximal and distal tibiofibular joint, the anterior posterior tibiofibular ligament, and interosseous membrane, MCL and LCL. They are important for the stability of the capsule or motility. So these are the medial collateral ligament. Here we can see the medial collateral ligament, and we are having the plantar calcaneo clavicular ligament, spring ligament. We are having the anterior talofibular here, calcaneofibular here, and posterior talofibular here. In this we can see the reticular superior, inferior, peroneal reticular, you can see. So here we are having the superior, here we are having the inferior extensor reticular axis. We can say the joint axis pass through malleoli and body of talus. So this is the axis of the ankle joint. Thank you.